Okay.
Hi, how is it going? I hope you had a pretty interesting, nice morning. Um, it goes on with the program with Dr. Alexander L. Gammal. He has been a surgeon at UKE and been a cancer researcher. That sounds like pretty interesting, and I'm really excited to hear his talk. He's talking about our digital health in 2030. I think it's going to be awesome. Alexander.
Yeah, yeah. Thank you. I'm also a senior clinical consultant at Philips. Just saying right now. So I used to be a surgeon. However, I have two conflicts of interest because I'm working for Philips, and I will be showing some fancy technology here, and also, yeah, that's the other one is that I'm part of a shareholder of a startup I will be showing. So maybe you come a little bit closer and you can see the slides. Okay, I'm going to talk about 6 major trends in digital health and what these trends will do in the future of digital medicine. So the 6 trends are sensing, big data, diagnostics, connectivity, precision medicine, and robotics. So what's up with wearables right now? There are lots of wearables on the market, and it's not just the little wristbands or something, but also lenses and ECG shirts, so there's lots of wearables coming right now. Also, there's smart furniture coming, so this is a smart mirror right here where you can actually see how you're brushing your teeth, if your skin needs any moisture or whatever, so this is also coming. Another thing is big data and AI, so it's data mining apps for disease scoping and patient management, and there are already lots of apps in the market right now, and people are using these to cope with their chronic diseases, and this is a really interesting article I found about which diseases are used for that. That's mainly diabetes, coronary heart disease, etc. Then there's also operational support in hospitals. This is a Philips product, and we're using beacons and infrared, wireless LAN, and Bluetooth for actually tracking assets and patients in the hospital, and you can actually do a process optimization on top of that. This is a startup that was yesterday also talking here. What they are doing is video surveillance and using a digital twin to anonymize this, what the surveillance videos are seeing, and you can also see behavioral patterns of patients there. So we have all this data coming in that somehow needs to be processed. Another trend is mobile devices. So even in medicine, devices are getting smaller, and now you have these small devices that you can actually wear in your pocket as a doctor and use it for example, sonography. So we have these small handheld devices here. And even for microscopy, this is a really interesting paper I found in Scientific Reports the other day, and you can actually use your cell phone now to do microscopics. So just imagine you being a doctor in a remote area where there's no microscopy available, and you go to the bed, take a little drop of a patient that might have malaria, and look at it with your cell phone. And if you don't have the capability to diagnose malaria, you can even send it to someone who might have. Another big thing is digitizing data that's already available. In this case, this is also a Philips product, digital pathology. And what they do is we actually scan the slides, the tissue slides, in really, really, really high definition. And the pictures are huge, like gigabytes big. And then you can really look at the pictures. And also, if you might have trouble doing the diagnosis, you can send it via a SharePoint, for example, to another doctor that might have the expertise to diagnose it. So another big trend is telemedicine. Last year, there was a law passed in August 2018 that telemedicine starts in Germany now. Other countries are way further, and you can actually contact the doctor from your home, or even consult a specialist as a doctor via telemedicine. This is a really interesting thing. I found that online. It's a Chinese company. They're called Ping An Good Doctors, and they have these telephone booth kind of things where you can actually walk in and talk to a bot. And if you look right next to it, there's a vending machine with medication inside. So this bots can actually prescribe you drugs. So this is 3 million people have already been treated with this. Another trend is precision medicine. So we tend to go from this broad approach to precise medicine designed for the for the certain patient. And what we have here is I found this paper online also, and what they actually do is they take CT data and design with this 3D scan prosthetics that are especially designed for the patient. So, and this is what we see more and more, that the combination of 3D printing and 3D imaging can be combined to do precision medicine. This is also a really interesting field. It's robotic surgery, and this field has been around for a while. It has been around for about 18 years, and there was not much movement. But this was due to a certain fact that a company had the patents on robotic surgery, but they expired 2017, and now lots of new robotic devices are flooding the market. In 2018, there were 5 new companies coming in. Next year, there will be big players like Google and Johnson & Johnson coming here. So this is a really excitement time right now, because the robots are getting better, cheaper, and that's also a really good paper. If you're interested in that, I can maybe give it to you if you ask me later on. So what could be the future of medicine look like? I know this is only 12 minutes, so I've been racing through this pretty fast, but these are only assumptions, so no guarantee on that. So I looked on the timeline right here, and we had the problem that robotic surgery was not profitable so far. This was due to the fact that I just told you that this one company had a monopoly, and they would just have really, really high prices, but now prices are dropping. So I assume that in 2022, it will be that robotic surgery will easily be profitable. So this is a milestone in 2022. Also, in 2023, chronic diseases will probably be widely organized in apps. Why is that so? Well, the insurance companies already push these apps, and they're really, really good for the people that are using them, because they get info material, and also the data can be used to optimize it. And I think that this data will eventually lead to prevention means in about 5 years or 4 years from now. Also, at around 2024, 2025, hospital process optimization will be widely used. Why is that? We start using it right now, and it's really, like in the hospitals, there's a big need for these process optimizations. Unlike in other industries, there's not much process optimization going on right now, and there can be saved huge sums. So I think that this is also that the process optimization will be done digitally with cameras or beacons or whatever. Also, at around 2025, medical chatbots will be widely available in remote areas in China. So why am I saying that? Because they started with this booth I was just showing you from Ping An Good Doctors in January, and they had in the first run 30,000 patients been seen, and in March they already had 3 million. So it's pretty likely that this will spread. And due to their, let's just say, lack of privacy issues there, it will probably be widely available. Also, mobile diagnostic devices will be commonly used in the ER, for example, or in the emergency setting in general. Why is that? Because it is already been used, or people start using these in the every time they really need, or let's just say they don't have the capability of carrying a big sonography machine around. So this small sonography devices are already used in the ER, and it starts to spread. So I think at around 2025, this will be the case. In 2028, I think 3D printing will be used regularly because it's just so convenient. 3D printing gets cheaper and cheaper. We actually already have the 3D data on that. So CT scans are nothing but regular 3D data sets, and you can actually use them to do 3D print. So why not do it? And more companies are using that technology right now and getting into the market. So I think prosthetics will be designed by 3D printers in about 2028. Why so long? Because it takes really long for new companies to get licensed in Germany. And also, in 2030, surgeons will start using standard, they will start using robotic surgery at around 2022, but in 2030, they will have that much experience and the AIs will be trained that well that the first subparts of surgeries will be performed automatically. Why is that? Or what do I mean with it? I don't mean that the whole surgery will be performed by AI, but small subparts of it, like skin closure or maybe anastomosis sewing, will be performed by that, because by that time the experience will probably be enough to have automatic programs running. Yeah, that's it.
Thank you, Alexander. That was pretty interesting. The future is near. Do we have some questions?
I have two questions, if that's okay. First one would be, what about prediction analysis? So that based on historical data, you can find out if a patient, how probable it is that he gets a disease. Do you think that's a realistic approach?
It is a realistic approach, but right now, due to the privacy laws we have, there's a certain lack of data. And I don't think in the next 10 years there will be so much movement, because the medical market is so slow to adapt to new technologies. So this is why, I mean, the predictions I do here are actually not that, it's not a big vision for the future, but something that would take place in the near future, I think, personally, because these trends indicate it now. Yeah.
Okay. Second question, why do you think is Germany so behind? Is it really only because of regulation and laws, or is there maybe other reasons?
Oh, that's a good question, and it has historic reasons, I think. I mean, Germany had this two totalitarian systems during the last 100 years, and people are really sensitive with their data, don't want to share it. For example, in America, you don't have these issues, so this is probably a cultural reason. Also, we have really, really old structures in the hospitals, hierarchies. People that are in charge usually are older and not really, don't really have an interest of implementing new technology. So that's one of the problems. Yeah, I think.
Alex, here. The vision you've described will require, to some degree, a new type of physician. How about training, education? What has to change so that the new doctors can use that to the full extent?
Yeah, that's a really good question. And actually, some universities are already implementing digital health into their curriculums. For example, the University Clinic here in Hamburg, and also in Lübeck and in Kiel, I know. And of course, this will really be a topic in the future, I think. And it's really important that now we start focusing in medicine on these digital points. Yeah.
Is there another question? Yeah.
Hi, my name is Arne. My question goes in the direction you were talking about, basically, I think mostly Germany, I guess. How do you compare them with a country like Israel, for example, where I think they have a lot of long history of digital health records, so they probably have a bigger data set to go to and to develop new technologies. Yeah.
I think, well, if you look at the study I was showing here with the big data, a lot of records there are from Israel. So they will probably have, they do have the same trends, but maybe it takes place a little bit earlier. That's what I think. But I'm not too familiar with the Israeli system, so I don't really know.
Okay. Is there something else you want to know? Now it's the time.
Hi, Alex. How do you envision the collaboration between innovative startups, big corporates like Philips, and actually thought leaders to develop that further in Germany?
I think that's a really good question, and I think the big corporations should really embrace startups and not only see them as competition, because they have so much drive and can move so much faster than the big corporations, and they should somehow implement these startups into their whole research and development thing, I think. And also corporations are first of all a good idea, and then maybe even incorporating these startups. And I think the necessity of a certain space for startups is really big right now in the big corporations. But in Philips we have that. It's called the Health Innovation Port. So if you have a startup, come over.
So,
Maybe second question related to this. So UKE, for example, has also startup initiatives, right? So how can, could a collaboration between hospitals, corporate startups look like to be more effective and fast, especially if we don't have funding and financing for, for innovative digitalization projects?
Yeah, that's a really good question, and I think it's a really big issue because the university clinics usually do the research and then apply for patent, but then when it comes to the capitalization of that patent, they're out. And we should look to America, I think, for that. For example, Harvard has this thing, it's called Health Innovation Lab, where they actually have startups that come from research projects in Harvard, and they offer them to come to their use their lab and build an own corporation. Startups, the Harvard holds like 30% or something from it, and they get all the support they need, including lawyers and everything. So I think this could be a good example for how we could work here in the future. The problem is in Germany that they're like most universities are not allowed to do that so far, because it's governmental money and it shouldn't compete with a. Yeah.
thank you, Alexander. We have a short break for 6 minutes, and then we're going to go on with Uwe Samuels from Square, our host.